Now, this is anatomical pathology, so we don't just discuss disease conditions based on physiology. We discuss disease conditions based on physical appearance too. So the next one which we are picking to look at how the disease will look like is what is known as the esophageal varices. Okay, so morphology of esophageal varices. Okay, so this is of esophageal varices. The morphology are just trying to describe, how the disease condition would be. Like they say, describe this. How can you describe? So just so you know, we'll look at the pathogenesis recap. So esophageal varices usually result from dilated submucosal veins in the lower esophagus. So you have the esophagus all around, but usually occurs in the lower part, which is almost close to the stomach. Okay, so they develop due to portal hypertension. Mostly maybe the person has liver cirrhosis. Okay, so there's increased portal venous pressure, so blood is now diverted into collateral veins. Now the veins in the esophagus become engorged. There's too much blood in it, and it now start forming all those round balls that becomes tortuous. You see that usually associated with liver cirrhosis. So gross morphology, so usually happens in the low side of the esophagus, so say the distal side, at the junction of the esophagus and the stomach. Okay, so stomach is the gastro. Okay, so it's a gastroesophageal junction. You understand? So appearance, you see tortuous, you see dilated, you see serpentine veins, they bulge beneath the mucosa. They appear as longitudinal ridges or nodular protrusions. Thin overlying mucosa, they are easily ruptured. So when they rupture, they lead to the patient vomiting blood. Okay, or sometimes the blood could still go down into the food, and when the person defecates, the stools are actually very dark. So on microscopic morphology, veins are markedly dilated submucosal veins. Mucosa is often thinned up, sometimes ulcerated. There's no true neoplastic change though. Then you can see inflammation, you can see necrosis, you can see hemorrhage. So clinical correlation, most of the times somebody will have esophageal varices and there will be no issues. They'll be living their life until it actually ruptures. So when it ruptured, there's a whole lot of bleeding. Alright, and you can even die because of the heavy bleeding. Okay, so that's the morphology of esophageal varices.